How do you approach brow or forehead surgery?
Well, this is another area that has interested me for a while, and I've actually just recently come up with what I think is a better approach. Brow surgery is something that is what I call a Goldilocks conundrum. I love that phrase. I just think it sounds neat. We all know Goldilocks is everything's got to be just right. The conundrum when it comes to forehead or brow surgery is how do you do that from patient to patient? Most doctors have one go-to technique that they use for patients that have ptotic brows, and then that's pretty much it. So it's hard to vary your technique based on the patient's anatomy, skin thickness, and other factors. So I've tried to figure out a way to quantify and qualify these patients and come up with a preoperative assessment where I could figure out what sort of lift and release I should do for each patient. So, and I think I've gotten pretty good at that over the past several years. The other problem that a lot of doctors have with brow surgery is they don't think about how the brow ages. As we age, the brow goes medially and inferiorly, and as we rejuvenate the eye, we have to go laterally and superiorly for men, at a right angle for women with an arch. So a lot of doctors, when they see a aging forehead, they just pull it straight up rather than the vector that goes this way, and they give patients that look that they had surgery, which again I find unacceptable. So I've come up with 3 releases that I do for patients that I call a lateral brow release, a 3/4 brow release, and a full brow release that depend upon their preoperative analysis of their brow position, thickness of their skin, and strength of their brow depressors. And I started applying this approach, I'm going to say about 5 to 8 years ago, and I found it to be quite helpful in getting predictable results that look natural for my patients. So it's something I think has been an improvement in my practice.